Well, if you can imagine, you take two pieces of material and rub them together more than they should, they're going to get worn down. They're going to get shorter, they're going to get more fragile. So if we see someone that has bruxism, then we know that they're susceptible to fracturing teeth, they're putting extra pressure on their teeth, and ultimately most patients want to keep their teeth and they want them to keep them to look nice. So if we see that early on, that's nice, so then we can tell them preventatively. A lot of patients we see we have to be reactive and say that some of this damage is already done, but here is the crystal ball if we do anything going forward.